We're revisiting our story on several cases of botched circumcisions that have been reported in the country. In fact, the Kenya Medical Practitioners and Dentists Council is investigating over 20 cases of botched circumcisions in various parts of the country. This is quite serious, and we'd like to get to the bottom of this, and particularly the post-circumcision complications. Why is this happening and what can be done about it? With me in studio is Dr. Vincent Hongo. He's a senior resident in general surgery and a healthcare manager, and also currently the CEO of Chiromo Medical Group. Thank you very much for joining us.
Thank you very much, Lillian.
I'd like to start with the circumcision procedure in itself.
Yes.
A time comes and a season comes, particularly in this country, when we look at culture, when we look at age group, a time comes when there's a rush for parents to take their teen sons for this procedure. So as a parent is taking this step, what should they bear in mind?
Thank you very much once again, Lillian Muli, for this invite. We really appreciate. One, as you've highlighted in the news, our prayers go to the family of this young boy who lost his life through this unfortunate event. It's true that it's a season where traditionally circumcising communities are going through that session. And we have that happening in December and in January. And we have seen a significant shift where most of the parents who are taking their children to traditionally cultural centers for circumcision in the transition from boyhood to manhood. We have seen now most parents embracing medical male circumcision and now seeking for this traditionally driven exercise in medical facilities. So it's important that most of the parents in traditionally circumcising communities get to understand that what is it that we need to know as parents.
What is it that we need to know as parents? And centering my question on this particularly because we have churches that are organizing circumcisions and taking the boys to camp. We have parents that are organizing themselves as a group and saying, now that our sons are the same age, we need to, get a doctor and have them go through this procedure together. So the key questions, the medical questions that a parent or a guardian should be asking the expert that's handling this particular procedure.
Thank you very much. The first thing is to understand that, and I'm happy there are churches and communities organizing this, who is the team leader? In most cases, it could be the traditional elder that they look up to. But in medically supervised circumcision, the qualification of the medical practitioner that is leading the medical arm is important, and the church or the community organizing this needs to confirm. I'm happy that the Medical Council, the Kenya Medical and Practitioners Dentists Council, has now publicly, for a long time, listed the doctors who are qualified to undertake medical practice in this country. So before parents take their children to camp for this particular exercise, it would be appropriate that they just confirm that our children are getting into safe hands. Two, once we have a medical practitioner leading this exercise, then the children have to be screened just like any other surgery. Circumcision is a surgical procedure, and as all surgeries, it is important that they are adequately examined, history taken, and screened. There are children who are coming in. It is transition from usually from standard 8 and now to Form 1, or in the new CBC system when they are getting into high school. Now, it is important that these children, if they are malnourished, that is assessed, because healing and the infection rates that we are seeing are also affected with malnutrition. There's poor healing when we have malnutrition. Two, some children have bleeding tendencies or bleeding problems that unfortunately come to fore are known at the time of circumcision when the bleeding does not stop. Again, there are children with other problems, underlying medical conditions, who, when they are not adequately picked up, then they can have higher chances of complicating. Again, there's a sexual organ, the penis. There are those congenital abnormalities. There are those that are born with short penis. There are those that are born with abnormalities on the urethra the point at which we pass urine. You find that it could be on the lower base of the glands of the penis, the foreskin could be short. So all these need to be clearly identified by a medical practitioner well before. Just like any other surgical procedure, history is taken, relevant blood tests are performed as indicated by the doctor, and then the person who is going to conduct this procedure also has to be technically sound as licensed by the medical council.
Now, post-cat supervision, and thanks for sharing that, post-cat supervision and a normal healing process and what it should look like.
Thank you very much. Children heal faster. So a child of any other age would take 3 to 5 days and would heal very fast. Adults may take a longer time, more than 5, probably a week or so. So in children, the normal course is to expect that post-circumcision, a medically supervised circumcision, in the immediate, there would be pain, there would be some bleeding that can be seen, but this bleeding is usually well contained. Immediately during surgery or immediately after surgery, we do not expect any level of bleeding. So that is one thing that parents should watch out for. The healing process, as I've said, takes 3 to 5 days. If it is taking longer, then the parents need to ask. The boy would be having pain for a longer duration of time. The boy would be having fevers, hotness, unusual hotness of the body.
So these are the things to look out for.
These are the things that parents need to look out for, because remember the excitement that they go through in the camps, the traditional ceremonies that come with this, it may cover up most of these things. But parents need to keenly, because the boys at this time, again, they don't want their parents, particularly their mothers, to be near them. So they tend to be on their own, but when medically supervised in the camps, then it becomes very easy to alert them. If you have fever, if you are vomiting, if the pain is increasing, if you start bleeding post-circumcision, if you're having chills, if you're having difficulties in breathing, then it indicates that you are almost always developing an infection.
And in terms of the post-care, now, right, whether it's within the home or whether it is while they're at camp, post-care in terms of handling this, because it's a surgical procedure, so there's still a wound involved.
Thank you.
In terms of post-care, what to avoid and what to do?
Thank you. The first thing, just like any other wound, there's the dressing. The dressing usually, 2 to 3 days, the dressing comes, the initial dressing that we place there comes off. We expect the wound now to be healing. That part that the cut happened should be healing, and they're allowed now to start bathing, what we call tepid or sponge bathing. We do not allow them yet to jump into dirty rivers and start bathing in rivers, any other concoction or herbs. Tepid, clean bathing. A septically done technique, again, we expect post that initial dressing, then now we can use sprays for parents who can afford, or just usual cleaning with normal saline or water. Yes.
Now, we want to talk about the reconstructive surgery, Dr. in terms of the timing and whether or not this is fixable in the event where we're seeing children who have undergone these procedures and have now had to be rushed to hospital. Let's talk about reconstructive surgery.
Thank you very much. For those botched surgeries that unfortunately maybe happened in unsafe hands, and the damage that happens to the sexual organ is quite severe, then reconstruction surgery may be called into. Who undertakes reconstruction surgery? Reconstruction surgery is undertaken by a qualified urologist. And I'm happy that in this country we've had an opportunity to work closely with the urologists, the Meso Center, Dr. Misango, and I also work very closely with Dr. Deda Nopondo, who is a senior urologist again in this country. So it is important that parents get to also understand who are the urologists who are qualified to undertake this exercise. I'm happy that this child is in Kenyatta National Hospital, where we have a very high number of qualified urologists. They then make an assessment, and then they'll design the reconstruction that is required. They call onto the plastic surgeons, vascular surgeons, to be able to sustain and have the right organ for the development of this child into adulthood that they were seeking.
And I'll just take you back as we begin to wind up, Daktari. The affordability of these procedures might be the cause and why we are seeing a lot of parents rushing to medical centers that are perhaps not certified, that are not recognized by the medical board. So in terms of affordability, how affordable is this procedure for the normal mwananchi who would perhaps want to go to the nearest, yes, indeed, certified medical institution or healthcare center?
Thank you very much. This is a highly affordable surgery. And it's a surgery that we consider it a day case surgery. You do not need to come and sleep in the hospital. In people who can cooperate, children 13 and above who can cooperate, it is done under local anesthesia. And that makes it highly affordable. That was one of the causes why most were resorting to traditional circumcision, and it was a major barrier to accessing safe medical circumcision. The government has invested heavily in having trained practitioners in almost each and every public hospital. So public hospitals are very safe centers for medical circumcision. And if it has to be done in camps, in churches, in traditional cultural centers, then all they need to do is to reach out to the nearest public health hospital, ask who is a surgeon in this center. The government has done so much in training many surgeons. I'm one of those beneficiaries in the training program. They have devolved this training program, and they are readily available. You just need to make a call, and they'll give you a technically sound practitioner who can oversee the transition of our children from boyhood into manhood.
Now, for the boys who have suffered these injuries, this may have psychological impact. How to deal with this as a parent or as a guardian?
Thank you, Lillian. The psychological burden that comes with a botched male circumcision is quite heavy. It is a burden that is transmitted across from the parent who was trying to transition a child with all the happiness into adulthood, to the child, to the other family members. Remember, this child who is at the center of all these things. The sexual function is a very important aspect of our social well-being. If that is affected from that tender age, then when this child is going through his or his life, then it would be important that he is well taken care of. These children who've had these botched surgeries, being admitted in several hospitals, is important because there are many clinical psychologists in these centers. Over and above the hard surgical aspect that the surgeons and related practitioners are dealing with, it is important that their psychological well-being is also taken care of, and by extension, the psychological well-being of their parents and their relatives who are waiting for them back at home for this traditional ceremony.
We thank you so much, Daktari. We've been talking to Dr. Vincent Hongo. He's a senior resident in general surgery and a healthcare manager, currently the CEO, Chiromo Medical Group. And thank you for walking us through the psychological implications and what can be done. Indeed, a serious issue with 20 cases of botched circumcisions being investigated by the Kenya Medical Practitioners and Dentists Council. These cases having been reported in the last fortnight or so. Many thanks, Daktari.
Thank you.
In other news, the family of slain